I now ask Dr. Prashant Bawankule to give his talk on Mirante technology with Nidek. That will be our last talk, and we'll have some discussion.
Thank you. So I would be speaking about the wide field imaging. In fact, this is a general presentation, not necessarily meant for the Mirante, but all these pictures have been taken with the Mirante system, which is by Nidek, which is a wide field multimodal imaging system. So, if you come directly, yeah, am I able to see? It's not moving.
So by the time the images are getting loaded there, any questions from the audience? Any clarification regarding the comparison? I had mentioned about the cost. So that's an important consideration you have to give, because there is an increase at each step as you go from Optos to Spectralis to Silverstone and to Mirante. So that's one factor. So probably if you are an individual practitioner, like especially for an Optos color imaging, you leave aside the FFA and ICG. I think if a few doctors get together and buy this machine, it would be a really good thing, because as I said, for many situations like small pupils, narrow angles, people with allergies, you cannot dilate these pupil, and sometimes if the patient is diabetic, if the patient complains of flashes and floaters, you have to dilate and see these patients. Are you ready?
Yeah, I'm ready. Yeah.
So I think that's one idea you can have. If a group of doctors in a particular city buys this machine or any of these machines, it should be then become financially feasible. Otherwise, most of the time, unless you have a very large OPD, this doesn't become very productive. Yeah, Prashant, please go ahead.
Yeah, thank you. So sorry for the technical glitch. So I would be speaking basically, as I said, this is a system from Nidek, and the model is called Mirante. Well, this is what everyone is aware. I think initial part of the IC we have kind of covered over there, that the standard fundus photography involves retina having a visualization of the retina for about 75 to 80 degrees. But you remember the retina exists from aura to aura, that is about 220 degrees. It means our diagnosis is based upon only one third of the retinal viewing, and based on that we presume and make hypothetical diagnosis as well as the prognostication or pathogenesis of this. So these are the things what in a ETDRS you see 75 degrees, wide field if you see up to 100 degrees, ultra wide field is if you are seeing anything more than 110 to 20 degrees. So this is what you see in a conventional standard central photograph. ETDRS, this is what you see. On a wide field you can see up to 100 degrees, and this in an ultra wide field, as Dr. Parekh has beautifully shown through us. So these are the right now available options which you have in the market. These are the plus minus points which I can share you later on. Now coming to this particular feature, you have a wide field OCT. Usually the standard photograph of a OCT has only 8 to 10 or 12 millimeter beam length. While in a wide field it is at least 16 millimeter, with the Optos it is much more. I will just come to the image, clinical image. This is a 80 years mother of a pathologist who had this particular lesion. This is wide field photograph. You can see a peripheral mount over here. You can see some subretinal hemorrhage over here. And this is what you can do with a wide field image. You can play with the image. You can actually view the particular thing. And this was a peripheral PCV. We could do a wide field OCT through the lesion per se, trying to understand whether at that age it is just a melanoma or it's a PCV. The characterization can help you in picking up exactly what is happening. And then we did a wide field angio, ICGs, whatnot you can play. This is the beauty of multimodal imaging. And we treated this peripheral PCV with brolucizumab. And subsequently you can follow this particular lesion whether it is regressing or not with a non-invasive technique like OCT, and you can see subsequent follow-ups how the lesion is slowly collapsing and reducing with time. Now coming to imaging in diabetic retinopathy, is one of the commonest reason where we use. Now we'll come directly to some clinical cases. This patient had a recurrent vitreous hemorrhage following having undergone a pan-retinal photocoagulation elsewhere. And this is the angiogram which the patient brought to us. So what do you see? You hardly see a new vessels. You hardly see that the CNP areas are lost. Some CNP areas over here in the same in the left eye. Now you look at the picture. in bigger field, ultra wide field. You can see the lasers have been scattered. They have not been done adequately the way it should be done. You can see some neovascularization, and you do an ultra wide field angiogram. You can see these laser marks, but look at the ischemia which is extending much beyond the equator. So the standard teaching to us has been that in a diabetic case disease, it is a posterior pole disease. So the panretinal photocoagulation should extend about 1 to 2 disc diameter away from the vascular arcade only up to the equator. While this particular ultra wide field imaging now challenges that concept. You can see the extension of the ischemia right up to the equator, and so is the need in such cases of doing a panretinal photocoagulation, which is fill-in panretinal photocoagulation right up to the equator. Otherwise, these new vessels will not regress. Now, this is a case of a retinal vein occlusion, which was imaged elsewhere. And when you do it in an ultra wide field imaging, you can see again the same thing. In a previous angiogram, this was the area of weave, while here you can see the CNP's area is quite in periphery. So now your laser is going to be as big as this area, so you are not sure what you are trying to do. Now this is a patient who was referred to us for a case of, means he was advised an anti-VEGF injection for a macular edema. But when we did an ultra wide field OCT, we thought the sciatic cavities are extending much more beyond. So it's no longer simple macular edema. So it meant it was a case of retinoschisis. But why was this patient having a progressive loss of vision was a question which was unanswered. So we did an ultra wide field imaging for this, angiography for this. I will directly come to it. And you can see in this particular case, in the left eye, peripheral telangiectasia. So this is a case of a telangiectasia which was responsible for additional macular edema in a case of a retinoschisis. So how did it help me? This wide field imaging, I did a laser to this area as well. I needed it in a degenerative disorder like retinoschisis. You don't need an anti-VEGF, but here we did a laser for this telangiectasia and for taking a macular edema, and the patient responded. So this is how it changed my management in this particular patient. Now this is a case who was diagnosed to have retinal detachment, advised vitreous surgery, but I saw some fibrous tissue over here. So I was not happy. I looked into the other eye. I saw similar fibrous tissue in the other eye. I do an angiogram, wide field angiogram, and you can see for FEVR. So this is a bilateral FEVR. So ultra wide field imaging as well as angio helped me in picking a disease which would have landed up with a detachment later. So I could prevent this disease from coming in the other eye, or preventing a complication in the form of detachment in the other eye. And this is naturally the operated eye. This is 52 years old female who had this particular presentation diagnosed as an epiretinal membrane. But when you look at an ultraviolet photograph, you can see there is some straightening of the blood vessels. So we did an wide field, imaging, and this we realized this again. It was a case of a FEVR and plus vitreomacular traction. So it needed a different management. Now this is 48 years male who had this particular patient diagnosed to have rot spots elsewhere. We did an angiogram for him, and you can see the peripheral shutdown, and same thing over here. Other eye also had a similar picture, and when we further investigated him, he had a bilateral carotid disease. So we prevented him from a morbidity or an absolutely mortal condition, which would, and this is how we helped in picking up a very morbid condition. This is another case. This is a patient who presented diagnosed Eales disease. We do an angiogram for this particular case, and you can see an half zone disease. Half zone disease is a terminology used in a cases of retinopathy of prematurity. This is for the first time we described a half zone disease. Again, he has a systemic disease in the form of bilateral carotid disease. Now this is interesting. 26 years old female girl who had healed choroiditis, but she had progressive loss of vision. We did an angiogram, ultra wide field angiogram, which we could see some ischemia in the periphery which needed treatment. Another case of a choroiditis with vitreous hemorrhage, where we could do ultra wide field imaging, and you can see that predominantly the vascular response in the periphery, which warranted a PRP, panretinal photocoagulation, rather a targeted laser only in the periphery, preserving the posterior pole. Now this is interesting. 25 years female diagnosed to have Eales disease with a combined retinal detachment. This is what the picture was. Naturally, she had a combined retinal detachment. But when we looked at the ultraviolet photograph, we thought we are seeing something abnormal in the periphery. So this is classic pruning of the blood vessels which have been described, which cannot be picked up on a standard photograph. Yeah. So we did an ultraviolet field angiogram, and this is what is we see as a Takayasu's disease, which we made a diagnosis of. This is Takayasu's disease. So this better eye needed a treatment in the form of laser before taking her the eye with a combined retinal detachment. Now this 19 years female had a tricycle eye following a VR surgery, and father gave a history of having operated for glomus jugulare. Grandfather had some operation for brain tumor, and this is the better eye. I was not happy. Even to my eyes with 20 years experience, I thought this is a fundus which is normal. I still had thought I should do an angiogram. And when I do an ultra wide field angiogram, I can see multiple vascular tumors in the periphery, which I had missed it very easily. And so this is how it was a case of a von Hippel-Lindau. She needed a multiple treatments in the form of laser as well as cryo, triple freeze cryo. Father was asymptomatic. We got him screened, and look again what we see on our ultra wide field, multiple angiomas in his case. Similar thing again, a brother was asymptomatic, clinically normal. You see multiple angiomas. So this is how ultra wide field imaging can help you in such rare diseases. And then 1 year later, the brother had recurrence. Again, an ultra wide field angiogram was done, and we could pick up the recurrences and new lesions as well. Of course, we did certain studies for this, and we could pick up the lesion. And following this, now the next case, this is 38 hours female with a vitiligo, and you can pick up the multiple, cysts like lesions. This is a case of a VKH, which we can pick up. Now we can do an ultra wide field imaging. Again, another case of a VKH, multiple blisters, which we can pick up here in an angiogram. This is another case, night blindness, diagnosed elsewhere as a case of CRAO. When we do an ultra-wide field photograph, yes, it was a CRAO superimposed over a case of a retinitis pigmentosa. This premature baby, thought to be a ROP, we could image. It is very difficult to image a baby. And while on a flying baby position, we did it, we could see the tumor as well as the secondaries in the vitreous cavity. Single image can make your life very easy. Even through a 4mm pupil, you could obtain. This is another triad of leukemia. You can see, rarely do you see all this triad of leukemia, that is a metastasis, infiltration, as well as a rot spot. Again, a cover page. So this is a 16 years old guy who had a Berlin edema diagnosed elsewhere. We told him you have an horseshoe tear. He was not ready to accept. We did a wide field photograph, and then he was ready to undergo treatment. So such reluctant patients can be actually, they see, they believe. Now I will come directly to a few of the other cases where you see an horseshoe tear with a lattice degeneration. So finally, yeah, I'm just summing up. These are lattices which you can pick up. This is another case where you are seeing multiple decompression retinopathy. Fine, friends. It's a costly technology. No true color is always at people who speak about the against this particular wide field imaging. But there is a role, because we see only 1/3 of the retina on a standard wide field photograph, standard photograph, versus if you are seeing total retina, you understand and have a better look. Regarding the cost, what is the return on investment is the second question which I always get across. I always say these are the cover pages, some of the contributions of the from our group, from our hospital to the ophthalmology. These are the cover pages which was our contribution to the ophthalmology as well as eye, and few more publications by us. So thank you, friends, once more for this opportunity.